Moving on to Assembly third reading. File item number 5. Mr. Secretary, please read.
Assembly Bill 7 by Assemblymember Mark Stone, enacting to employment.
Senator Monning.
Thank you, Madam President. Members, Assembly Bill 7 will close loopholes in California's smoke-free workplace law. California's landmark smoke-free workplace law was passed by the legislature in 1994, contained a number of exemptions that to this day force many Californians to work in employment settings where they are subjected to secondhand smoke exposure. This bill will remove many of those exemptions and will prohibit smoking in employee break rooms, warehouse facilities, owner-operated businesses, hotel lobbies, and meeting and banquet rooms. Members, I ask that you join me in ensuring that all Californians can work in an employment setting that is free from the dangers, the proven dangers of secondhand smoke. I urge an aye vote on AB 7.
Any discussion or debate? Senator Hertzberg.
I support banning smoking in the workplace. The right thing to do. A lot of arguments here today that articulate that. But when you read the bill, our job is not just to support public policy that is important, but our job is to write laws that work. And I represent a community in the San Fernando Valley where a lot of folks work out of their homes. This measure seeks to jurisprudentially define what they term in the measure owner-operated businesses. Well, and it talks about smoke-free environment. So if somebody in the home is a smoker and lights up a cigarette at 9 o'clock in the morning and has a client coming in at noon or a bookkeeper coming in at noon, is that a smoke-free environment? We could argue that that is because no one's smoking at the time, but I certainly have personal experiences where there's someone smells smoke. Is that an infraction? Is that a violation? I don't know. The reality is society is changing. More and more people are working out of their homes. The company JetBlue dismantled its entire operation, and people who are the phone callers, when you call up to get a reservation on JetBlue, you're calling somebody in their home and they've got a computer there. What if there's a coworker? I'm not suggesting that there's not a way to do it. I'm just suggesting that we have a higher obligation, and it's hard for someone like me, a Democrat, to stand up on a tobacco bill, and I'm sorry, this is not about tobacco. This is about writing the laws in a way that work for folks. I don't want a situation, the most important thing as a Democrat is confidence in government. I don't want somebody who comes along and gets angry at somebody because they smell smoke at the house and the police come because they say there's an infraction. That's not good for us. We want laws that work. We undermine the moral authority of law as legislators on either side of the political debate when we don't write laws that work for folks. And all I'm saying is, it burns me to have to stand here now. It's easy to discredit me to say Hertzberg stood in violation of smoke in the workplace. Nobody has lobbied me. I have not talked to anybody. I got briefing by staff. I talked to my tax staff this morning. I looked at the bill for the first time because I wasn't in the committees to see it. And it's just, has holes you can drive a truck through. All I'm saying to you is we stand proudly about this deliberative organization that we are as the California State Senate, as the greatest deliberative body there is in the United States of America. And I'm telling you that we need to fix the laws, we need to do it right, we need to be honorable to our job, and as we choose to pursue these kinds of important public policy measures, we should do it in a way that works and does not undermine confidence in government. And so it is with great, I'm not going to oppose the bill, but I'm not going to vote for it today, not because I don't support its cause. I just think it needs a little bit more homework to make sure that we do this in a way that actually works for society. Thank you so much.
Thank you, sir. Further discussion or debate? Senator Morlock.
Thank you, Madam President. I rise in opposition for exactly the same reason. I did go to the committee meeting, and I asked the author, can you work out of your home, and can you smoke at home? He says, you can smoke at home, but if you have a client come to the house, you can't smoke at home. I see that as an infringement on personal property rights. I think that's a flaw in this bill. We should amend or look at some solutions here that says, if you want to come to my home, I want you to be fully aware that I smoke. Maybe that could be done in an email saying, here's a disclosure that, and maybe I should inform you on the phone when you ask to come over and we set up the appointment. Be aware. My wife is allergic to cigarette smoke. We don't enjoy cigarette smoke at all. I'm not here to defend cigarette smoke, but my goodness, I think we're overstepping a little bit here. We should at least maybe at the front entryway of the home says, this is a home where on occasion we smoke a cigarette product, be it a cigarette or a cigar, and you should be fully aware. And if we need to meet elsewhere at a restaurant or something else, then we have that option. So with that, colleagues, I urge a no vote.
Thank you. Any further discussion or debate? Seeing none, Senator Monning, please close.
Thank you, Madam President. I want to thank my colleagues for their raising what I also consider legitimate concerns. Let me offer this reassurance. The bill does not prohibit a home business owner from smoking at home. What it seeks to protect is the customer or client, or if there are employees at that home work setting, protect them from secondhand smoke. This bill strikes a balance, the main protection to protect consumers, clients, and coworkers from secondhand smoke. It does not prohibit a business owner from smoking in his or her own home or home business environment until clients come through the door. With that, Madam President, members, I urge your aye vote. Let's protect all Californians from secondhand poisonous smoke. Thank you.
Mr. Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Canella? No. De Leon? Fuller? No. Gaines? No. Galgiani? Glazer? Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Hill? Aye. Wesso? Aye. Huff? Jackson? Aye. Lada? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Runner? No. Stone? Vidak? No. Wykowski? Aye. Wolk? Wolk, aye.
Call the absent members.
De Leon? Aye. Galgiani? Glazer? Hertzberg? Huff? Mendoza? Wynn? No. Roth? Stone? No.
Ayes 21, noes 13. The measure passes. Assembly third reading, file item number 6. Mr. Secretary, please read.
Assembly Bill 9 by Assemblymember Thurman and Act relating to tobacco use programs.
Senator Liu.
Thank you, Madam President. Members, AB 9 will require all California schools to adopt and enforce a tobacco-free campus policy, which would include electronic cigarettes and smokeless tobacco. Under existing law, there is no uniform statewide prohibition against smoking on K-12 school campuses. However, Proposition 99 does provide funding to the California Department of Education to administer the Tobacco Use Prevention Education Grant Program. This program provides grants to local education agencies for the implementation and enforcement of tobacco-free campus policies. But less than 50% of LEAs receive grants and are required to be tobacco-free. Schools are consistently enforced tobacco-free policies have seen decreased rates of smoking among their students. By requiring all LEAs to become 100% tobacco-free and including smokeless tobacco and e-cigarettes, AB 9 will help ensure that schools protect students and personal health while reducing tobacco use among our youth, and I ask for your support on the bill.
Thank you, Senator. Any discussion or debate? Any discussion or debate? Seeing none, Mr. Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? Bell? Aye. Berryhill? No. Block? Aye. Canella? Aye. De Leon? Aye. Fuller? No. Gaines? No. Galgiani? Aye. Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Hueso? Aye. Hill, aye. Huff? Jackson? Aye. Lara? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell?
Aye.
Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? Aye. Nilsson? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? Aye. Vidak? Aye. Wachowski? Aye. Wolk? Wolk, aye.
Call the absent members.
Bates? Huff?
Ayes 30, noes 8, the measure passes. Assembly third reading, file item number 7. Mr. Secretary, please read.
Assembly Bill 10 by Assemblymember Bloom and Act relating to local government.
Senator McGuire.
Good morning, Madam President and members. Tobacco is the single most preventable cause of death and disease in California and throughout this great nation. Nationally, 1 out of every 5 deaths are attributed to smoking. Here in the Golden State, that adds up to nearly 40,000 residents every year passing away from smoking-related diseases. There are many different ways Californians can kick the habit, but time and time again, according to all the leading experts in studies, price point for a pack of cigarettes, chewing tobacco, and other tobacco-related products is widely recognized as the most effective way to reduce smoking, especially among young people. In fact, according to the American Cancer Society, for every 10% increase in the price of cigarettes, there is a 4% reduction in overall cigarette consumption and a 6.5% reduction in youth consumption. It's clear that price point moves the needle towards a healthier California. It has been 16 years since California last raised its tobacco tax, and during that time, we've seen our state's costs of providing health care for those inflicted with a tobacco-related disease increase significantly. In fact, according to the Center for Disease Control, smoking-related diseases cost California roughly $13.29 billion in medical expenses each year. The fact is this: California has one of the lowest tobacco taxes in America at 87 cents. Moreover, Madam President, smoking disproportionately impacts low-income communities. Smoking prevalence is higher among those who are younger, have lower incomes, and are either on Medicaid or have no health insurance. All of this leads to additional local government financial obligations and increased challenges for those segments of our population that are often the most vulnerable. Nationally, over 600 local jurisdictions have their own cigarette and tobacco taxes. Unfortunately, here in California, no local cities or counties have a health-related tax related to tobacco products because it's currently prohibited by law. Allowing local control is the right thing to do because of the cost of smoking varies on a county-by-county basis. In fact, it costs each resident in Orange County $374 per year relating to tobacco-related diseases. It's $4.4 billion total in Los Angeles County. This bill is practical. It allows counties to place a local tax initiative onto their local ballot to let voters decide to impose a tobacco-related tax or not. To be clear, a county's Board of Supervisors would first need to vote to put the measure on the ballot, and then it would go to the voters. By raising local cigarette and tobacco taxes, county would have the resources to implement tobacco prevention and health programs and target those dollars in the neighborhoods of greatest need. Finally, Madam President, tobacco tax revenues can help California counties take advantage of new federal matching funds available under the Affordable Care Act. I would respectfully ask for an aye vote.
Thank you, sir. Discussion or debate? Discussion or debate? Senator Anderson.
Senators, I asked the Assembly member author in committee if there are any protections in this bill that limited the use of those additional revenues to tobacco in tobacco-related items. So, for example, could this money, these taxes, be used, say, to fund a road or to give raises to county or city employees? There's no protection whatsoever. So the idea that we're going to be taxing tobacco to pay for anything other than education and weaning people off of tobacco is very difficult for me to support. This is in my opinion, this is the worst aspect of government. When you tax somebody and you give them the illusion that the money will be spent on health care, and then you don't guarantee that it is spent on health care, and it's shifted to something entirely different. If we were really serious about this, we would ensure that that money taken from smokers goes to health care for their later years when they need that money. When it goes to, we talked about Orange County and how expensive it is, the health care for smokers in Orange County. But there's no guarantee any of this money is going to go to those smokers in Orange County. It could go to preserving beaches. It could be going to anything under the sky. So I think it's disingenuous on one hand for us to say and give the illusion to our constituents that we care deeply about getting children off of cigarettes and weaning them off, when the very taxes that we're imposing on tobacco have nothing to do with health care. So for that reason, I won't be supporting this today.
Senator Linnell.
Thank you, Madam President. Colleagues, respectfully, there's nothing disingenuous about this bill at all. It is a very simple concept: local control. Let county boards of supervisors, by majority vote, decide whether or not to let the voters of that county decide for themselves whether they'd like to raise some additional money for purposes they would decide. If they want it for general fund purposes, it would be a simple majority vote at the ballot. If they want it specific to health care issues, it would be a special use tax and a 2/3 threshold. We're not a part of that debate at all. All this bill does is allow local legislators accountable to their voters have the opportunity to let their voters decide, rather than Sacramento dictating from here what they can and cannot do. Very simple concept. I ask for your aye vote.
Seeing no further discussion or debate, Senator McGuire, you may close.
Thank you very much, Madam President. And just a quick comment. I do not know why some in Sacramento are afraid to let local voters make local decisions. Why would we stand here today as a body who are elected by voters and not let voters decide how they want their taxes spent? It is about choice, ladies and gentlemen. There's nothing disingenuous about letting voters decide how they want dollars spent in their communities. And by the way, if we want to talk about being disingenuous, we know, ladies and gentlemen, that there are two ways, as the senator from San Francisco just described, that voters can decide to either earmark specific dollars or not. I would respectfully ask for an aye vote.
Mr. Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Aye. Canella? No. De Leon? Aye. Fuller? No. Gaines? Galgiani? No. Glazer? Aye. Hall? Aye. Hancock? Hernandez. I. Hertzberg. Hill. I. Weso. I. Huff. Jackson. I. Lada. I. Leno. I. Leva. I. Lou. I. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. Morrell. No. Wynn. No. Nilsson. No. Pan. I. Pavley. I. Roth. No. Runner. No. Stone. No. Vidak. No. Wykowski. I. Wolk. Wolk, aye.
Please call the absent members.
Gaines. No. Hancock. Aye. Hertzberg. Huff. Morlock.
Ayes 23, noes 14. The measure passes. Assembly third reading, file item number 8. Mr. Secretary, please read.
Assembly Bill 11 by Assemblymember Nazarian, enacting to cigarette and tobacco product licensing.
Senator Bell.
Madam President and members of the State Senate, this bill, AB 11, updates the cigarette and tobacco products licensing program by updating the licensing fee imposed on retail locations and distributor and wholesalers. The bill establishes an annual fee of $265 for retail locations and $1,200 for distributors and wholesalers. Now, this corrects a problem because when this program was established, there was a one-time fee imposed. So the money goes to the enforcement and operation and administration of the program. It goes directly to the program. And the one-time fee of $100, which was established decades ago, is not recovering the cost of the licensing fee and maintaining licenses for retail establishments. As a result, the Board of Equalization requires subsidy to cover the licensing and administration of the program. The subsidy actually comes from the first 5 programs: tobacco education and prevention programs, and the breast cancer research funds and the general fund. It is evident quite clearly that the lifetime retailer fee, the one-time fee, is not adequate to maintain a viable enforcement program. Members, this is a true fee. This goes only to direct program administration and enforcement. We believe that this meets the definition of a true fee. The additional revenue generated from this bill will eliminate the need to divert tobacco excise taxes from those purposes I mentioned. It's good for business as it helps enforce the tobacco control laws and stop violators from circumventing the law and competing against legitimate businesses. Let's have a regular funded ongoing enforcement and administration of our laws regarding cigarette and tobacco licensing. This provides a cost recovery fee that will go only to that enforcement. I respectfully ask and I vote.
Thank you, Senator. Any discussion or debate on the measure? Any discussion or debate? Seeing none, Mr. Secretary, please call the roll.
Allen. I. Anderson. No. Bates. No. Bell. I. Berryhill. No. Block. I. Cannella. I. De Leon. I. Fuller. No. Gaines. No. Galgiani. Glazer. No. Hall. I. Hancock. I. Hernandez. I. Hertzberg. I. Hill. I. Weso. I. Huff. Jackson. I. Lada. I. Leno. I. Leva. I. Lou. I. McGuire. I. Mendoza. I. Mitchell. I. Monning. I. Morlock. No. Morrell. No. Wynn. No. Nilsson. No. Pan. I. Pavley. I. Roth. No. Runner. No. Stone. No. Vidak. No. Wachowski. Aye. Wolk.
Please call the absent members.
Galgiani. No. Huff. Wolk. Aye.
Ayes 24, noes 15. The measure passes.